This is a realistic conversation at hospital between the doctor and the patient. Listen it carefully and improve your English speaking and listening skills.
Good morning, ma'am. I hope you are feeling at least a little better today, so I came to check on you and talk about how your body is responding to the treatment we started last night.
Good morning, doctor. I am still feeling weak and a little dizzy, but I think the pain is a bit less compared to yesterday, although I still feel very uncomfortable.
I understand, and it is completely normal to feel weak after the kind of infection your body is fighting. But I want you to tell me more about what exactly you are feeling right now, so I can decide whether we need to change anything in your medicines.
Well, doctor, I still feel a sharp pain on the right side of my stomach when I move or try to sit up, and sometimes I feel a warm sensation inside, almost like something is burning slowly.
Thank you for explaining that so clearly, because the sharp pain you are describing is actually one of the common symptoms of the infection we diagnosed, and it helps me understand that the swelling inside your abdomen is still present and needs more time to heal.
Doctor, I am a little worried because this pain makes me feel scared, and I keep thinking something serious might happen if it does not go away soon.
Please don't worry too much, because we are monitoring you closely every few hours, and all your reports show that your condition is stable, which means your body is slowly improving, even though the pain is still there.
That makes me feel a little better, doctor, but sometimes I feel very tired and I cannot even lift my arms properly, so I want to know if that tiredness is normal.
Yes, it is very normal, because when your body is fighting an infection, it uses a lot of energy, which makes your muscles feel weak and heavy, and once the infection reduces, your strength will slowly return.
I see, doctor, and I also wanted to ask about the medicine you gave me last night, because after taking it, I felt very sleepy and my mouth became dry.
The medicine we gave you is a strong antibiotic and also a pain reliever, and both of them can make you feel sleepy and give you a dry mouth, but these side effects are temporary and will go away once the course of the medicine is finished.
All right, doctor, thank you for explaining that, because I was not sure if I should tell the nurse or just ignore it.
It is always good to tell us, because even small symptoms can help us adjust your treatment, and I want you to feel comfortable and safe during your stay here.
Doctor, will I need to stay in the hospital for many more days because I am worried about my family and my work?
I understand your concern, and based on your current condition, I think you may need to stay for another 2 or 3 days so we can continue giving you medicine through the IV drip and make sure the infection is fully under control before we send you home.
2 or 3 days is okay if it helps me recover, but I hope the pain reduces soon because it makes it hard to sleep at night.
We will increase your nighttime pain medicine slightly, which should help you sleep better, and we will also ask the nurse to help you adjust your position on the bed so the pressure on your abdomen is less.
Thank you, doctor. That would really help because sometimes when I turn to the side, the pain gets worse and I feel like crying.
It's all right to feel emotional when you are in pain, but remember you are getting better each day. And the fact that your fever has gone down shows that your body is responding well to the treatment.
Yes, I noticed that my fever is not as high as before, and that gives me some hope that I will recover soon.
Exactly. And if your blood test results this evening show improvement, we may even reduce the number of antibiotics tomorrow, which means your body is healing steadily.
That is good news, doctor, and I am very grateful for the care you and the nurses are giving me.
We are happy to help, ma'am, and your positive attitude is also helping your recovery. So just continue resting and drinking plenty of water throughout the day.
I will do that, doctor, and thank you again for taking the time to explain everything so clearly to me.
You are welcome, and I will come again in the evening to check on you. So if you feel any new pain, discomfort, or anything unusual, please tell the nurse.
I will inform the nurse if anything changes, doctor, and I appreciate your kindness.
Take care and try to rest now, because your body needs all the energy it can get to recover.
Subscribe English Paper to learn English.